So the upcoming timeline for logbook 2 session is 15th of March. So you have already submitted your logbook 1 with us. The timeline was 15th of January. And logbook 2 is a part of continuous assessment, which carries 40 marks. And the timeline is 15th of March. As you are aware, logbook 3 is a submission of a termed examination, which is we call department specific report, and which carries 30 marks, and it is of submission timeline is 15th of April. In between, I will be admitting to students, those who are joining. So allow me. Yes. Yes. So in logbook 2, there are two kind of submissions are there. 20 marks for infection control part and 20 marks are for the biomedical engineering department. Okay. So initially we will talk about infection control and later about the biomedical engineering department. Under infection control, the aspects which we will be covering is like HAIS, hospital acquired infection surveillance, hand hygiene, personal protective equipments, spill management, antibiotic policy, and about infection control committee. As infection control, decreased immunity, infection control plays a critical role in a hospital, because the decreased immunity increases in the number and the variety of invasive techniques and the medical procedures which create potential route for infection amongst the patient. So what is the definition of hospital acquired infection? Hospital acquired infection is also labeled as a nosocomial infection, which can be defined as an infection acquired in a hospital by a patient who was admitted for a reason other than that infection. Okay, so infection which is acquired to a patient during his stay in the hospital, which is other than the infection for which he has admitted in the hospital. So infection occurring in a patient whom the infection was not present or incubating at the time of admission, but present while at the time the patient stay in the hospital, right? So surveillance is an ongoing, continuous, systematic process of collection, analysis, and interpretation and dissemination of data regarding specific health-related event or any incident happened in the hospital, which is generally for the public health action to reduce morbidity and mortality and to improve patients' stay and improve health outcome of that patient. So usually what is the purpose of doing hospital infection surveillance? It is usually to reinforce the practices and procedure, because it is an ongoing process. Every time the staffs are being trained to the practices and the procedures to be performed in the hospital, with a view to reduce HAI, to assess the impact of prevention and control measures, which will create a baseline rate. Right. So every hospital at the every month we calculate like how HAI patient were obtained and how they were treated, and what are the measures are done to minimize and rectify such events to be happening in the hospital. So satisfy patients' care standards and regulatory requirement with a view to conduct research, and yes, of course, to defend against the lawsuit. Also, it has been established in developed countries that surveillance of HAIs raises the awareness, improves care, and ensure patient safety. However, this is only possible when surveillance and infection prevention is accepted by each and every person of the hospital along with the patient, by both the administrative staff and the clinical staff of the hospital. So you have to observe in your particular hospital that what are the measures are practiced related to the HAIs. So next you will see or inquire in your hospital, is there an infection control department? Is there any committee which has been established to assess, monitor, and execute the infection control, infection related aspects in the hospital? The HI Control Committee provides a multidisciplinary platform for inputs, cooperation, and information sharing among its members. So this committee should have a wide representation. Who all can be the members of this committee? So there will be a wide representation from the entire different teams of the hospital, which will include departments like hospital management personnel, a physician, a surgeon, a microbiologist, a epidemiologist, nursing in charge or matron, pharmacist, and representative from the central sterile supply department and maintenance department. Okay, so the committee, what are the functions of that committee? The committee must report directly to either hospital administrator or the medical staff to promote program effectiveness and visibility. And the committee should, there are certain norms are being displayed by the CDC regarding infection control committee. So based on that, those norms to be practiced, and the committee should meet frequently and whenever if there are outbreak in the hospital, and periodically the committee should note down all the parameters discussed there. If at all any untoward incident happen in the hospital, they needs to be documented, rectified, and everything is to be documented and to be submitted to the CEO of the hospital. So this is related to the infection control committee. Next is a very important hand hygiene practices in the hospital. So normal human skin is colonized with the bacteria called the normal flora, and hands of the healthcare workers may be persistently colonized with the pathogenic flora, gram-negative bacilli, or yeast, or many some bacteria. Right. So one of the most important measure to prevent HAI is a maintaining hand hygiene. So you have to look for your hospital. If at all there are any posters are being displayed in the critical area, especially in the OT, in the ICU, in the NICU, PICU, and in the central sterile supply department, are there any hand hygiene posters are being put, like the staffs are being trained frequently regarding hand hygiene, especially in the nursing staff and the surgeons? Frequent awareness in the hospital. So such kind of poster usually at the OT sink area, or especially in the nursing area, are being put. In our Symbiosis Hospital, we have a practice of making public announcements that the importance of hand hygiene. So that way we can create awareness among the staff, clinicians, and the nursing staff and the housekeeping personnel, those who are those who are handling patient. So because of such announcements, it creates an icebreaker among the monotonous job of the staff, and it will create awareness and reminder to them regarding hand hygiene. Right. So next is a personal protective equipment. It is a specialized clothing or equipment worn by an employee for protection against infectious material. This is a definition from the Occupational Safety and Health Administration. So in your hospital, recently from the COVID only, the PPE kits have one more importance. So donning and doffing of the PPE kits, whether the staffs are being trained about it or not. So sorry. So this is all related to the PPE kits. The staffs are being trained, like how the donning and doffing to be done. The display of like the processes of donning and doffing are being displayed in the critical areas or not, especially in the isolated wards where the infectious patients are being admitted. So how the patient staffs or the nurses are handling those patients. So they should be made aware about the processes. Next is the spill management. So in spill management, there are like small and large spills are there. So in your hospital, you have to look for the infection control manual, like up to what quantity of spill is considered as a small in your hospital, and what is considered as a large spill. So you have to ask your hospital, are there any guidelines available regarding spill management, how it is to be managed? So you will ask about it and you will note down in your logbook to records. Next is you can see about like, are there any antibiotic policy made by your hospital? Are there any antimicrobial regarding antimicrobial resistance awareness is being spread in the hospital or not? So you will be asked about it. Since we are sitting, since I'm sitting in the hospital building of our hospital, so you can hear those announcements, right? Students, if at all you have any query, you can unmute yourself and you can ask at the end of the session. Okay. So, so regarding antimicrobial resistance, how it is to be prevented, who all are involved in the prevention of the antimicrobial resistance. So you will ask all these details in your hospital and you will make a note about it in your logbook to report. Okay, so till the time we talked about infection control. So under infection control heading, we saw like what is the hospital infection, acquired infection. Then we talk about hospital infection control committee. You will look for like awareness about hand hygiene, PPE kits, and antimicrobial policy. Okay, antibiotic policy is there in your hospital or not? So this is related to infection control committee. This is related to infection control part, which carries 20 marks. So based on those 5 headings, you have to write down your report and you will be your hospital. Okay. And the next part is the biomedical engineering department. So biomedical engineering department also carries 20 marks. So what is biomedical engineering department? Biomedical engineering department is a department in the hospital which deals about the biomedical equipments and the engineering part related to those equipment. So this field seeks to close the gap between the engineering and the medicine. It combines the design and the problem solving skills of engineering with the medical and biological sciences to advance the healthcare treatment, which includes the diagnosing, monitoring, and the therapy. So policy is about planning and installation of biomedical equipment. So I hope I am audible. Okay, so we were talking about policies about planning and installation of biomedical equipment. So the task, there are different tasks which are to be performed at the hospital. Initially the inventory and the documentation. The inventory of medical equipment should be maintained at the department at the store level of the equipment. Also check for the maintenance contract and the insurance. So initially we will seek for the requirement of that particular instrument, and once it is required, the bids are being floated and once the vendor is finalized, then we go ahead with the purchase of that particular equipment. And during the purchase of that particular equipment, we talk about, we see for the maintenance contract insurance of that particular equipment. Next is the commissioning and acceptance. Commissioning, it is a process of like getting that instrument or equipment into the hospital. So the competent authority should ensure the installation and the commissioning of the equipment by the manufacturer and the supplier. And the process should be monitored by the in-house technical staff so that any technical matters can be asked to that particular vendor at that time. So everything is to be noted and recorded in the maintenance register while during the commissioning of that particular equipment. The occasion also provides an excellent opportunity in-house staff to gain familiarity with the new item. So, and during this commissioning and acceptance process, a kind of training is also given to that particular staff who is going to use that machine in the hospital, technical person. The monitoring of use and performance of that particular equipment. So it is important that the user should make a safe use of the equipment and also continuously monitor the performance of that equipment. So the performance of that equipment means the main equipment will require every time that particular instrument or the equipment should give the accurate result. So there is a minimum range of that particular results of that particular equipment, or so it has to be at par as per the requirement. So many equipment will require daily, weekly inspection, and some equipment may require simple maintenance. So it depends on the vitality of that particular equipment or instrument. So equipment maintenance plays an important role in a continuous, safe, and effective, reliable operation of that equipment so as to give the reliable and the accurate results. And next is the maintenance of that equipment. Under maintenance, there are two parts. One part is a planned preventive maintenance, and next part is a breakdown maintenance. So as name specifies, only it is stating that what is planned planned preventive maintenance and what is a breakdown maintenance. So maintenance, proper maintenance of the medical equipment is essential to obtain sustained benefits and to preserve capital investment. Medical equipment must be maintained in a working order and it should be calibrated weekly or quarterly for the accuracy of the results. So planned maintenance involves planned maintenance is usually done to extend the life of that particular equipment and to prevent its failure whenever it is in a service. So planned preventive maintenance is usually scheduled at a specific interval and it includes specific maintenance activities such as lubrication, calibration, or cleaning of that particular equipment, or replacing the part that are expected to wear or which we have like the definite life is there, right? So that way certain part has to be replaced of that particular equipment. The procedure and the intervals are usually established by the manufacturer and everything is planned in this regard. And the records of planned preventive maintenance should be maintained department wise and should be available at any point of time. Next is a breakdown maintenance. The name itself shows that breakdown maintenance is usually done whenever the particular equipment is in a service and during offering its service it got breakdown, right? So that particular service is hampered and it is no longer in use for the patient treatment or the diagnosis. So it's a task performed to identify, isolate, and rectify a fault so that out of order equipment machine can be restored to an operational condition. All medical equipment in use should be free from any fault or defect, and all repair work should be carried out to expected standard by the competent person. So any breakdown happening in the hospital is a major loss to that particular hospital. So here the preventive maintenance plan plays a critical role. If at all you are monitoring your preventive maintenance plan, then there are very less chances of having a breakdown. You are going for a breakdown maintenance because it carries a financial burden to hospitals since the particular equipment goes out of order and it is not in a operational condition. Okay. So, and for each and every maintenance, the record to be maintained and documented in the equipment registers. So next is the equipment audit. Equipment audit is a periodic evaluation system to measure the quality of performance of the medical equipment. So for this matter, the equipment committee is established in the hospital, and usually the equipment audit is done by the equipment audit committee. There is a committee has been established. So who all can be the member of that particular committee? The medical superintendent or the designated medical officer of that hospital, the head of the concerned department, head of the maintenance department, representative from the finance team, representative from the hospital manager or the administration team, the nursing superintendent, the hospital store in charge is a part of that committee. And it has to be done 3 months or the half yearly basis. So committee has to review all the records and they have to see like are there any missing out on preventive maintenance, or if at all there is any breakdown maintenance, then what is the reason, what is the cause behind it. So certain kinds of points are discussed in this equipment audit committee. Calibration also plays a critical role in the maintenance part. So it is carried out to minimize the uncertainty in the measurements, reducing errors and bringing measurements to an unacceptable level. With repeated use and over a period of time, all the equipment begins to degrade and it affects its accuracy, right? So there are FDA guidelines are being given regarding calibration and the maintenance of that particular equipment. So on regular basis, the accuracy and precision to be checked. If at all any error is found, the corrective measures to be taken. And if at all any adverse effect happens, it has to be documented and evaluated to minimize the occurrence in the future. So that way how the biomedical engineering department works, and you have to write about it from your particular hospital about biomedical engineering department. So this is all related to the logbook to submission. Till the time we ended with the next 20 marks of the biomedical engineering department. Here we saw about biomedical engineering department. We saw about like the purchase of the equipment. We saw about the commissioning of the equipment. Then we check for the maintenance part of the equipment. And maintenance part includes two types. One is a preventive and next is a breakdown. And calibration also plays a critical role. And there is an equipment audit committee who looks after the entire functioning of the department. And it will critically evaluate and gives their suggestions. So this is all related to logbook 2 submission. So the way you will submit your logbook 2. For any queries, now you can unmute and you can ask question.
Ma'am, I wanted to ask that routine maintenance and repair and maintenance are part of preventive and breakdown, right?
Routine maintenance is a part of preventive because we are trying to prevent the occurrence of that incident, right? So if you see, we at home
So we
also
have to
we keep.
just mention it in a.
No,
So
no, you
my
have to
co
write
my
about the process. What is preventive maintenance? What is breakdown? Because
yeah.
if you visit your hospital, then they will share with you their manual, how their functioning is happening. They will show
Yeah,
you
so
like.
my query is, yeah, my query
Hmm,
is preventive maintenance. There will be the subheading of routine maintenance. No, not an
right,
individual
right.
heading.
Yes,
Yeah.
yes. It will be under preventive, right?
Okay. Okay.